Hi, my name is Annalise Murphy, and I'd like to discuss several of the drugs commonly used to care for patients undergoing general anesthesia with cardiovascular related issues. The first drug I'd like to discuss is clofidipine. Clofidipine is a calcium channel blocker of the dihydropyridine group, also known as Clofibrex. It comes supplied in 50, 100, and 250 ml vials with a concentration of 0.5 milligrams per ml. It comes prepared in a lipid emulsion solution and should not be diluted. IV infusion doses are 1 to 2 milligrams an hour that is titrated by doubling the dose every 90 seconds. The maximum dose that should be used is 32 milligrams an hour. However, less than or equal to 16 milligrams an hour is often effective in managing blood pressure issues. There is no indication for bolus dosing at this time with this drug. The mechanism of action is that it works on L-type calcium channels and is highly selective for vascular smooth muscle. Its arterial effects lead to a decrease in the systemic vascular resistance and has minimal effect on decreasing the preload. Its onset is from 1 to 4 minutes and it lasts about 5 to 15 minutes after an infusion. The next drug I'd like to discuss is another dihydropyridine calcium channel blocker, nicardipine, also known as Cardine. This dihydropyridine calcium channel blocker has the most significant effects on coronary artery vasodilation of all the calcium channel blockers. It is often supplied as 25 milligrams in 10 mL. For anesthesia-related purposes, it is often diluted to 25 milligrams in 250 mL for a final concentration of 100 mics per ml, or as 25 milligrams in 100 mL of NS for a final concentration of 250 mics per ml. An infusion dose for this medication is 5 to 15 milligrams an hour that is increased by 2.5 milligrams an hour every 15 minutes until the blood pressure goal is achieved. Once this goal is achieved, it can be maintained with a dose of 5 milligrams an hour. Bolus dosing is anywhere from 100 to 200, even 300 if indicated, mics. This medication works by binding to voltage-gated L-type calcium channels, thus preventing the calcium influx into the myocardial and smooth muscle cells. This then prevents the excitation coupling that would result in a contraction. Its onset is in 1 to 3 minutes and duration is 10 to 30 minutes following a bolus dose. The next drug I'd like to discuss is furosemide, or Lasix. This drug is a loop diuretic that is unlike some of the other available diuretics, as it is still highly effective even in patients with severely limited renal function. It comes supplied most frequently in 10 milligrams per ml, and the common dosing used is 0.5 to 1 milligrams per kilogram if weight-based dosing is desired, or 5 to 40 milligrams up to an 80 milligram dose. Mechanism of action for this drug is that it inhibits the resorption of sodium, chloride, potassium, calcium, water, and phosphorus in the ascending loop of Henle. Its onset is approximately 5 minutes and its duration is about 2 hours. The next drugs I would like to discuss are nitroglycerin and labetalol. Nitroglycerin, also known as nitrostat, is a vasodilator that works primarily on the venous side and is sometimes referred to as a venodilator. It is prepared as 50 milligrams in 250 mL of NS or D5W for a final concentration of 200 mics per ml. An infusion dose for nitroglycerin is 5 mics per minute that is titrated every 3 to 5 minutes by 10 mic per minute increments. The maximum dose that is often used is 200 mics per minute, or if weight-based dosing is desired, then 1 to 3 mics per kilo per minute with a max of 10 mics per kilo per minute. Bolus dosing may be used, though it is often off-label, and 5 to 100 mic doses for bolusing may be indicated for blood pressure control. Mechanism of action of nitroglycerin is that it is metabolized to nitric oxide, which acts as a smooth muscle relaxant on venules much more significantly than arterioles. The net result is a decrease in systemic, coronary, and pulmonary vascular resistance. Its onset is 1 to 2 minutes and its duration is approximately 3 to 5 minutes. The final drug I'd like to discuss today is labetalol, also known as Trandate. Trandate, or labetalol, is an alpha and beta adrenergic blocker. This drug is selective for alpha-1 receptors and non-selective for beta-1 and 2 receptors. It has a 7:1 beta to alpha ratio when given IV and a 3:1 beta to alpha ratio when given PO. It's most often supplied as 5 mg per ml, and bolus dosing may be given as 0.1 to 0.5 mg per kilogram, though most commonly dosing is seen as given as 5 to 20 mg as needed for blood pressure management. Doses may be repeated every 5 to 10 minutes until a maximum dose of 300 mg has been reached. If an infusion is desired, dosing at 0.05 mg per kilo per minute or 2 to 150 mg per hour may be given, depending on whether you choose to use weight-based or standardized dosing. The mechanism of action is achieved through the alpha and beta adrenergic blockade. This results in decreases in blood pressure, heart rate, systemic vascular resistance, pulmonary arterial pressures, and CVP. Cardiac index may also be affected by administration of these drugs. Onset is approximately 2 to 5 minutes, and duration is between 2 to 4 hours. Thank you very much.